Imagine losing your healthcare overnight just so billionaires can get a tax cut. If you're sitting comfortably thinking your healthcare is safe, think again. A new Republican backed bill could see nearly 14 million Americans lose their Medicaid coverage. That's not a typo. 14 million. So, how did we get here? And why are millions of working class families being targeted while the wealthiest Americans cash in? Let's break it down. House Speaker Mike Johnson claims that Republicans aren't cutting Medicaid. In fact, he says it's all about stopping fraud, waste, and abuse. Sounds noble, right? But let's take a closer look at what that actually means. The non-partisan Congressional Budget Office looked at the numbers, and the truth is brutal. Nearly 13.7 million people will lose their health coverage under this bill. That's not a theory. That's a confirmed estimate. But Johnson's defense? He says it's not a cut, just a crackdown on so-called fraudsters. Who exactly is he talking about? Apparently, young men who aren't working, immigrants, and people on benefits who he claims shouldn't be there. In other words, if you're poor, struggling, or disabled, you're suddenly under suspicion. He even suggests that people in his own state of Louisiana, where 1.4 million rely on Medicaid, are abusing the system. That's almost 1/3 of the state's population. Let's be clear. Medicaid isn't a luxury, it's a lifeline. It covers low-income families, children, disabled people, and the elderly, those who cannot survive without it. To qualify, your income often needs to be under £28,000 a year. That's not a lot when you factor in rent, bills, and food. And yet, Johnson paints these people as leeches. But here's what he's not telling you. Studies show that fraud in Medicaid is extremely rare. Less than 1%. No one is being charged with fraud. Not in Louisiana. Not anywhere. Because it's not happening. This isn't about saving the system. It's about gutting it and using that money to fund a huge tax break for the top 0.1% of Americans. Let that sink in. According to a report from the University of Pennsylvania's Wharton School, the richest people, those making over $4.3 million a year, stand to gain nearly $400,000 under this bill. Meanwhile, working class Americans will lose money on healthcare. Those making less than $17,000 a year could lose over $1,000 on average. That's not reform. That's economic warfare. And the victims are the sick, the poor, and the vulnerable. And here's the kicker. When people lose Medicaid, they don't stop getting sick. They just lose the ability to pay for it. They still show up in hospitals. But now they're uninsured. That cost gets passed on to all of us through higher prices, overwhelmed emergency rooms, and worse public health outcomes. But Johnson and his allies aren't moved. Why? Because this isn't about protecting people. It's about scoring political points and rewarding donors. And the cherry on top. They frame all of this as morally right. Cutting care for diabetics, cancer patients, and struggling families is somehow the noble thing to do now. Let's not pretend. This is cruelty wrapped in political spin. So the next time you hear a Republican say they're pro-life or that they care about family values, remember this moment. Because if stripping healthcare from millions while giving tax handouts to millionaires is what they stand for, then they don't stand for you.